Um, Yeah, so from that survey, we actually learned that most of the need was for perimenopausal and menopausal support. And actually, a lot of that was for education as opposed to anything else. And so that's how this health series came about. We decided that we'll do educational seminars. A lot of people also said that their issue tends to be being able to get to the masjid or attending these talks, which is why we're doing them in the evening virtually. So thank you for your feedback. If there is any feedback following any of the talks, please let us know. If there's things that you feel that would be more helpful to you, let us know. And we're happy to try and accommodate that and organize these things. But yeah, the aim is essentially to be able to do something that will help you and eliminate that need within our community. And then hopefully, if this goes really well, we can hopefully start doing these more globally as well. So, essentially right now we're starting from scratch. So we're going to go by your suggestions and your guidance for what you think is going to help. Okay. So please don't hesitate to send us your feedback along the way. I'll start with a little bit about myself. So my name is Dr. Fatima Kapasi. I think I know a lot of you, but definitely not all. I'm a family physician. I graduated in the UK, and then I did a lot of hospital medicine there, and pediatrics. And then I decided to go into family practice. So I did my specialization in general practice, and then I've been in Canada for the past 3 years, where I've been working as a GP. So I have my practice here and I focus mainly on women's health and children. Um, so yeah, so this is an area that I have a lot of interest in. So please feel free to approach me at any point if you do have any questions, even after this talk. Okay, so perimenopause and menopause is a really, really big topic. It's not something that we're going to be able to cover even in 2 sessions. So you'll probably have a lot of questions. Please feel free to shoot them our way. But for now, we're going to try and split them into a 2-week series. So today, we're going to talk about what perimenopause is, what menopause is, what symptoms to expect, why it's important. And then next week, inshallah, Dr. Ishira Shamsuddin is going to go through the treatment, how we can manage it and what we can do about it. Okay, so let's get started. So as I said, today's aim mainly is to understand what your understanding of menopause is and then what menopause medically is understood to be, the impact of what perimenopausal symptoms can have on our body, the challenges in identifying the symptoms and getting help for it, and then all of the symptoms or most of the symptoms of menopause that we can potentially get. And just to get a better understanding so that we feel able to identify these symptoms in ourselves and then to be able to go to our doctors and talk to them about it. Okay, so if you can take just a couple of minutes to think about or write down what your understanding of menopause is. So, what you think menopause means. I know the word is thrown around a lot, and people know that it's a phase of our lives, but what actually menopause is, what you've heard of symptoms of menopause, or what your understanding is of them, and what you're hoping to achieve from this talk, because that would be really useful in terms of feedback for you to be able to see whether actually did you get what you wanted out of it, and if not, let me know and we can improve on that and maybe even arrange another talk if you feel that there was so much lacking that you wanted to know. Okay, so um, just have a think of that and have that at the back of your mind as we go through this presentation. Okay, so why does menopause matter? There are a lot of reasons, and none of them are more important than the others. Okay, so firstly, it has a huge impact on women's health in general, particularly long-term consequences of your health. The how people manage menopause and their perimenopausal symptoms can really affect their life or really half their life going forward. We'll talk about that in a little bit more detail a little bit later on. Menopause symptoms can really disrupt a woman's life. So some people will go through menopause and not even be aware of it, whereas others will feel it from the moment they get their first symptom, and it can go on well into their 60s, their 70s, and sometimes even later than that. So the impact of menopausal symptoms varies entirely, similar to pregnancy or even something as simple as having a period. Some people don't even know about it, whereas others are in pain and stuck in bed. It can really, really vary. It affects half of the population, and actually, data suggests that most of us don't really know much about it. We don't really know what to expect. We don't know what the symptoms are or how to identify it. And a lot of people don't actually know that treatment exists. There is a, I beg your pardon, there's a lot of misinformation about menopause, and the biggest one that I hear getting thrown about is the concern about menopause or HRT, which is hormone replacement therapy, which is known treatment for menopause causing cancer. It is a really, really big hurdle to cross because there was a study that came out many years ago that really escalated that fear. And even now, I get people who don't want to talk about it because they think that's the only treatment. But more importantly, they wrongfully believe that it causes cancer. And I'll leave that for next week when Dr. Rashida Shamsuddin does her talk. But it's not it's all on a scale. So yes, while it slightly increases your risk of cancer, it much less than, for example, being overweight. So it's all a scale. It's actually not that significant. And if you compare to birth control, which a lot of people do take, the risks are similar. Well, again, we'll go into that in more detail later on. The other one, and this is probably the most important one for us as a community and as the South Asian population, is the fact that it is so socially stigmatized and it's taboo to talk about in many cultures, including our own. And as a result, we don't talk to each other about these symptoms. We don't feel comfortable to mention what we're going through. So no one really knows from each other's experiences, and no one knows when they're suffering something that they should get help for. So that's something that we can all play a part in trying to break that taboo so that it is something that becomes normal. It becomes normal and comfortable for us to talk about so that we can get the help that we need early on because it really, really can affect um, a lot of people very significantly. It's also a good opportunity at menopause for people to explore their health in general. So because we know that our bodies change around menopause, it's a very good time for us to think about how we're going to change our exercise routines, our healthy living, because that can really impact our life going forward. Often we think that, once we reach our 40s or our 50s, that's it. We don't need to work out, we don't need to look good. All of these things do have an impact later on. And so it's a really good phase of life to be able to kind of think, okay, I just need to change how I'm doing things, and it will really make an impact on how your quality of life is. And that just takes me on to my next point about the fact that if we manage the perimenopausal phase really well, it can really promote healthy aging and good quality of life because life expectancy is about 83. And so if you think about the fact that you're potentially menopausal for a really significant portion of your life, if you're healthy, that can be really good quality life as opposed to if you're struggling with all of these symptoms that we're going to talk about later. And as I mentioned, there's little open communication and support. And that's from healthcare professionals and from one another too. We just need to open that door into that communication and support. In terms of the public health challenges, and there are many regarding menopause, the big factor is also that we've noted that ethnic minorities tend to get dismissed a lot in terms of their symptoms. And also they tend to go and seek healthcare a lot less, which makes it all the more harder to address these really, really important changes. There's lack of awareness, even amongst healthcare professionals, and as a result, there's lack of support from healthcare providers. So often there are many family physicians or GPs who don't really know a lot about managing menopause and the treatments that are available, and so they don't counsel women for it. And often it takes quite a few visits to your doctor before the word menopause will even come along, unless you've got very straightforward symptoms. But even then, accessing treatment becomes difficult. So that's where you come in. If you have the knowledge, like information from this talk, for example, you can go up to your doctors and feel empowered to say that, this is what I'm worried is going on. Can we discuss treatment options? And if they can't do it, you can ask for to be referred to someone who might be able to. Sexual well-being, it's something that is really overlooked, particularly in the South Asian community. In our cultures too, we pretend that anyone above the age of 50 is not sexually active, and so it's something we never talk about. Yet there are so many menopause-related symptoms that are sexually driven, and we'll explore that a little bit more. But that is something that we do need to start being comfortable with accepting that it is a normal part of life. There's also lack of awareness within ourselves. If we don't know that we're having symptoms that are menopausal and they have treatment for it, we're not going to go to a doctor. And so obviously there's no option of treatment because we've not identified that there's something that we need treatment for. Again, these things are embarrassing to talk about, where, it's hard to actually get up and go to a doctor and tell them that, I'm having vaginal symptoms or I'm having these symptoms and I want to talk about it, or, my sexual drive is reduced. Is there anything we can do? As an Asian woman, that becomes really difficult to talk about, but those are the barriers that we need to start to break. It's often not discussed in, let alone in families, in communities, actually. If we discuss it, as I said before, with each other, we will identify similarly to, if someone came up to you and said, I'm having these symptoms, and I really I'm struggling to function. It's starting to affect my mental health. If you know that this is something that needs treatment or there's a treatment available, even if you don't know what to do, the very least you can tell them is, look, this is a real symptom and you can get help for it and help is available. And that is going to make a huge difference, because sometimes just validating someone's symptoms can make a huge impact, as opposed to telling them, "Nahi, kai nahi hoy, it's just menopause," right? Um, and then lastly, the health needs of perimenopausal women. So they're much higher. A lot of studies have shown, but again, access remains poor because we're not advocating for ourselves. If we don't show up for treatment or if we don't go to seek treatment, it doesn't appear to be a big enough medical issue that it actually is. So we need to start standing up, and healthcare professionals alone cannot do that. We need to all advocate for our own health. Okay, so let's talk about a few statistics. So as I said, life expectancy in Canada is 83 years for women. Average age of menopause is 51, but generally, most people start or get into menopause from the age of 45 to 55 years, which generally works out to about half your lifespan that you're going to spend either perimenopausal or menopausal. Out of all the women that go through menopausal symptoms, three out of every four, that's 75% of women, have symptoms that will interfere in one way or another with their daily functioning, right? Which, when you think about it in terms of quality of life, that's very significant. Out of those, 25% of women have severe menopausal symptoms that really inhibit or reduce their functioning on a day-to-day basis. And often it can be the cause of broken families too, because those symptoms start to impact on daily function. So let's go on to what menopause actually is. So universally, every single woman goes through menopause. Okay, it is a normal phase of life that everyone will go through at some point or another. It is called menopause when you got to the point where you've not had a period for 12 months, no less. Okay, so it has to be from your last period. When you reach 12 months, that is officially considered menopause, regardless of your age. You could be 30. If you haven't had a period for 12 months, you could be in menopause. Okay, after menopause, your body makes very low levels of something called estrogen and progesterone. And these are two of the main hormones, and we'll talk about what they do. And these are the reasons that we get the symptoms that we do in menopause. In terms of how menopause happens, I've been talking about perimenopause a lot. Perimenopause is basically the period between when you have had 12 months of no periods and from the point when your symptoms start. So as soon as your symptoms start to you not having had a period for 12 months, that period is called perimenopause, and it can be as long as 10 years. So if 51 is the average age that people go into menopause, i.e. 12 months of no periods, menopause can actually, your symptoms can start at the age of 40. Okay, and that it could be something very mild, something you're not aware of, irregular periods. It could be just mood changes, but that can start as early as that. And the treatment, again, is dependent on what symptoms you're having. So you don't have to have treatment, but some people have symptoms that are bad enough to warrant treatment. Premature menopause. So under the age of 40, it's called premature menopause. Or we usually call it primary ovarian insufficiency, because it means that menopause has happened a little bit too early than is considered acceptable. And so usually we do look into other causes for that. And if it's happened before the age of 40, you do need to seek some advice from your doctor. Early menopause is usually between 40 and 45 years. As I said, on average, menopause is considered normal between 45 and 55 years. Late menopause is from 55 to 60. It's not very common, but it does happen. Sometimes people do go into surgical menopause where they've had their ovary surgically removed for any reason, for example, um, cancer, or if they've had treatment for cancer. So chemotherapy can cause something called medical menopause, which is where your ovaries stop functioning because of these very strong treatments like chemotherapy, radiotherapy, or something called ovarian suppression therapy. And so it can, all of these things can cause menopausal symptoms and can cause you to go into menopause. Again, all of them can be treated or can be managed rather. Postmenopause is the day after you reach menopause onwards. So when I say that you can spend half your life in postmenopausal, that means after your last period. So the causes of menopause, there are, as I said before, it's a natural process. Everyone can go through it during aging as a part of aging. However, as I mentioned in the last slide, there are medical procedures like chemotherapy, radiotherapy, usually from cancer treatment that can cause menopause. You can have surgery that can cause it. And the other thing is that some conditions, medical conditions, particularly conditions that affect your own body. So they're called autoimmune conditions like thyroid diseases, like type 1 diabetes. They can also cause people to go into menopause a little bit earlier. Okay, so estrogen, I want to just talk a little bit about it because this is the primary hormone that is responsible for a lot of the menopausal symptoms that we go through. It's not the only one, but it is the most significant one. Estrogen is a really important hormone that works with sexual and reproductive development in women. So from the time we get to puberty, and I'm going to talk a little bit more about that in a little bit. So I'll move on to the next point. It's made mainly in the ovaries, which is why when the ovaries are either removed or they stop producing estrogen, we just don't have enough and we get the symptoms. But there are other cells in the body, like the fat cells and adrenal cells, which sit just above your kidneys. Those also make a very small amount of estrogen. Men also have it, but again, in smaller amounts. Um, and let's go through the effects. So on the breast, it is also responsible for the breast tissue that we get during puberty, and during pregnancy, it's responsible for our body preparing to breastfeed, also produce breast milk. In the heart, it actually affects the levels of good and bad cholesterol in the body, which is why the risk of heart disease usually increases in postmenopausal women. So women who are past menopause tend to have a higher risk of heart disease as a result of reduced function of estrogen. The uterus. So usually what happens is every month during a period, the lining of the womb, the uterus thickens, and that's what we end up shedding if we're not pregnant. That thickening is caused by estrogen too. In the bone, it helps stopping cells from breaking down your bone, which is why after menopause, you're at a higher risk of having something called osteoporosis, which is where your bones get really weak and brittle, and there's a risk of them breaking easily. So you normally hear of people in their 60s and their 70s, really, when they fall over, they're at higher risk of hip fractures, and that's usually because of a condition called osteoporosis. Again, this is a condition that we can prevent simply by doing things like taking vitamin D, making sure we're taking calcium, and doing strength training exercises. And it is something that we can monitor. So again, if you see your doctor about these conditions, particularly after menopause, everyone should have something called a bone density scan, which will show whether you have weaker bones or whether your bones are fine. And then it's usually repeated every 3 years. So it's important to know that, so that even if you haven't gone for your physical, at least if you just mention it to your doctor, you can have that scanned done if you're already postmenopausal. Okay. And then lastly, in the vaginal area, the estrogen is what's responsible for causing your mucus production in the lining of your the vaginal wall. And so you can get dryness after menopause because of the lack of estrogen, and that can cause a lot of symptoms. So I'm going to just group the symptoms of menopause into a few different sections. So this one is the most common symptom of menopause that most people know about. They're called the vasomotor symptoms of menopause, and generally it's night sweats and hot flushes. This is one that I actually have heard people talking about fairly openly. Hot flushes is when you suddenly feel an intense um, feeling of a sensation of heat, usually in the upper part of your body, so the neck, the face, the chest, and then it's followed by a period of heavy sweating. It can last anywhere from a few minutes, from a few seconds to even up to 10, 15 minutes, and sometimes you can have multiple of them one after the other. Where this happens at night, they're called night sweats. It is out of all of the symptoms of menopause, it's the one that we very frequently will in relative to all the other symptoms, we'll see women coming in to see us for. There is treatment for it. There's a lot of different treatment options. And out of women that experience menopause, 50% have it for about 7 years or so. They'll have these symptoms, and some of them have it for even 15 years or longer, but much less in terms of a percentage. People who do have these symptoms also do have a slightly increased risk of heart disease going forward, and that's worth knowing because even if your symptoms are not bad enough to warrant treatment, it should be something that should trigger you to go and get checked out in general in terms of your heart health if it's not something that you've done. Most people, so 75 to 80% of women will have a vasomotor symptom. So the night sweats or hot flushes, they will experience some degree of that. Some it's very mild and it doesn't bother them, whereas others are really, really bothered by it to the point where they can't sleep at all. So as I said, in that sense, it can really affect quality of life because if you're not able to sleep, it then affects your mood, it affects your productivity and your concentration. So often it can leave people so debilitated that they can't even work after menopause. So it's definitely worth seeking help for it. The good thing about these symptoms is over time they do tend to improve. So it's not something that gets worse with time. It tends to actually get better. So if they are mild, it is certainly an option to not treat it. But as I said, because the heart risk is increased, it's a good idea for you to just get some a review from your doctor or a physical, just to make sure your heart is in good condition, particularly with regards to your cholesterol levels, your sugar, your blood pressure, and then address all of those as needed because they can also affect your general health of your heart. And as I said, there's a lot of effective treatment options, whether that's hormonal treatment, whether that's things that you can do at home, they all exist. So, um, this is another group of symptoms that people get, and they're also very, very common, but just people don't tend to come in a lot for it. And actually, these are the ones that tend to be misdiagnosed often, because there are lots of other causes for these symptoms too. So, I'm just going to quickly just explain a little bit of the anatomy. This is not an accurate picture. It's just a random picture for the sake of the slides. But just even on this, I'll just explain. So this is supposed to be your ovaries. They're actually much smaller in real life. This is your uterus. This is your vaginal wall. So this is your vagina. So this is the inside of your body. This is supposed to be the vulva or the skin on the outside. Okay, so when I talk about vagina, I'm talking about this tract here. This area here is your cervix. I don't know if can you see where I'm pointing? Okay. Oh, you can't see my cursor. Okay, that helps. Can you see it now? Wait, can you see it now? Yes. Okay, so these two are your ovaries. This is supposed to be your uterus. This is the skin around. So this is the outside, and this is the vulva. And this opening is basically where your vagina opens into. That's your vaginal vault, and that's where your cervix starts. Okay, so usually when I say dryness, it tends to affect this area and this section right here. Okay, so in terms of the three different areas of genitourinary symptoms, it just basically means genital and urinary. Urinary meaning bladder, and genital meaning your genital, your sexual organs. So your genital tract essentially. So sexually, because of lack of mucus production, as we discussed earlier, because that's what the estrogen does, um, it can cause reduced lubrication. So that area becomes very dry. And the problem with that is if there's not a lot of lubrication, sexual intercourse becomes extremely, extremely painful. And so a lot of women don't want to have intercourse. I had a patient who came in to see me just recently, actually, a couple of weeks ago, and she asked me if it was safe for her to have intercourse because she's in her 60s, and I said, well, yes, there's no medical reason you can't. And so she asked me if I can, she's a Punjabi woman, and she asked me if I can tell her husband that she does like that she's got a medical problem, and so she's not supposed to. And so obviously she's my patient. She wanted me to do that, and I agreed. But I advised her to stay back, and I was just like, okay, let's discuss why that's the case. Like, what is it? Like, is it that you don't want to? And she's like, one, I don't have the drive at all. And two, it's so painful, but he doesn't understand that. And so we discussed the options for treatment, not so that she can have intercourse, but just for the sake of her symptoms, because these symptoms were really, really bothering her, right? But clearly she didn't think of it as being anything. She told me that, well, this is what all women go through. It's not a big deal and it doesn't bother me, but it is very, very painful to have sexual intercourse. And so all we did was we tried topical vaginal estrogen, which doesn't have the increased risk of cancer. It only works locally, so it's really great treatment, and it works really, really well for most people. And so she's using that even now. She feels completely different. I haven't asked about whether the situation has changed with her husband, but she told me she feels very different in herself because it actually can make a very big difference to your quality of life. Um, the other symptoms that also can improve with just getting some topical treatment where you're not taking anything orally is vaginal dryness, and the discharge that people get. Sometimes people are really bothered by that. It can help. I have seen it work. It's also common to get burning, pain, irritation, itching, and just like because you're itching, you're scratching, and you're getting tears around the vulva, so around the skin that I mentioned, just on the outside. There again, there is a local topical treatment that can treat that really, really effectively. Further on, so some women actually end up getting weakness in the walls. So just around the walls here on the side of the vagina, on the walls, they kind of become weak, and so they start almost spilling into the actual canal. And then you kind of feel a heaviness lower down, and that can cause pain, and it can cause pressure symptoms, and also it can be really, really uncomfortable because you constantly feel like you're dragging down below. Again, there are treatments for that, and this can be menopausal driven. And so sometimes menopause treatment can help it too, but there are even just physical treatments that we can do, that like pessaries, for example, that can actually help. In terms of urinary symptoms, this is probably one of the most underdiagnosed causes in terms of menopause being a cause is UTIs. A lot of people get recurrent urinary tract infections, so urine infections, and they'll go and get antibiotics, and then a few weeks later, they'll have another urine infection. It causes burning when you pee. It's painful to pee. You pee very often. Like every time you go to the toilet, you feel like I need to go again. Sometimes women get urgency. So as soon as you feel like you've got that sensation that you need to pee, you need to rush. Otherwise, you're gonna lose a few drops of urine. Stress incontinence is also common, so passing a few drops of urine every time you cough or you laugh. And so this can be related to it too. Waking up at night to pass urine as well is another common symptom. And then a urethral carbuncle, which is a small lump that people get on top of the urethra, which is actually the tube that you pee through. So it's just above where the vaginal opening is. Right above that is your urethra, and just above that you can get like a small little growth that can be really irritating, but that can also be because of menopause. So again, all of these things tend to be treated recurrently, but sometimes all you need is to consider menopause treatment, and that can help these symptoms. Okay. And then this is a topic that is a topic within itself. Mental health symptoms in menopause. It is a really, really, really important topic, and it is one that actually the symptoms start very early. We may or may not recognize them, and for a lot of people, we tend to ignore them because we think we can fix it or we can snap out of it. It is not true. It is because of a change in the hormone levels within our body. So it is something that we're not in control of. People tend to complain of feeling low in their mood, they feel unhappy, they feel depressed, they feel guilty about those symptoms, especially because they feel like, I've got everything in life. Why am I so unhappy, or why am I finding it hard to have, feel that sense of joy? um, as a result, they start not wanting to go out, things that you were enjoying, you might not want to do. And that is all part of the depressive process of symptoms. Sometimes people get more anxiety than depression, so they just feel tense or nervous everywhere they go. They find it really hard to relax. People complain of memory problems, like they're just forgetting things very easily. They get panic attacks when they go out in public. So again, they just avoid going out in public, which then makes their symptoms worse. As a result, you can stop eating and drinking. You can just deteriorate within yourself, and then it becomes much harder to treat as well. Anger and irritability is also a really, really common one. Loss of confidence, that's a big one that usually affects people because they feel invaluable when they get to a certain age. They feel like they're not valued. People, especially within our culture, so the South Asian community, we tend to disregard symptoms from menopausal women, really. So when people talk about menopausal symptoms, it's often not validated. And as a result, it leads to this further reduction in confidence because you feel like no one's taking you seriously, no one believes your symptoms. Sometimes you might go to your doctor and they might kind of not validate those symptoms, and then it kind of feels even worse, right? So things get worse. But it's really important to address this. If you notice in someone that's close to you, if you notice a change in their behavior, if you feel like they're not quite acting like themselves, take it upon yourself to even go and speak to their doctor. Their doctor might not be able to tell you what's going on, but they'll definitely listen and document it, and then hopefully try and see what they can do to help that person. They may not share that information with you. um, Depression and depressive symptoms are two different things, but both are more common in a perimenopausal woman compared to older or younger age groups. Okay, so whether it's depression related to depression as a mental health condition or depression symptoms due to menopause, they're both higher in this age group. So it's something worth keeping an eye out for. Additionally, mental health is always caused by lots of different factors playing in together. And this is the age group where you got lots of other stresses. You might have the vasomotor symptoms of menopause, so the hot flushes, night sweats, which is making it hard for you to sleep. That can worsen your mood. You might have had stressful life events. You might have problems with your sleep anyway. You might have had a previous history of depression or even a history of postpartum depression, or even PMDD, which is where people get really severe depressive symptoms, but just during the time of their periods. All of these things can further increase your risk of depression during this time period too. In terms of other symptoms, if you look at this picture, every part of your body is somehow represented on this, which shows that actually menopause affects every part of your body. It can cause heavy or irregular periods, sometimes both. It can cause headaches, osteoporosis, which is the brittle bones that I was talking about earlier. Arthritis increases after menopause, heart disease, so cardiovascular disease, muscle aches, joint pains. People tend to gain weight. It's harder to lose the weight, and we tend to do less in terms of exercise. So that adds to that weight gain. And then abdominal symptoms. So things like bloating, gas, nausea and vomiting, cramping, all of that can be because of menopause. Okay. Now, as I said, a lot of symptoms coexist with other medical conditions. So sometimes women are actually diagnosed with depression, but their symptoms are not depression, they're due to menopause. And so antidepressants, if they're not working, that could be an indication that this is not the barn door depression. It might actually be menopause. And so treating menopause may be an option in this. Sometimes it's not, depending on the age, but it is something to think about. Sometimes people get diagnosed with something called chronic fatigue syndrome, which is where you just feel tired all the time. Now, tiredness is probably one of the things that people present most to a family doctor for. And often there are 100 different causes for it, but sometimes people get diagnosed with chronic fatigue syndrome, which basically means that you've got a condition, but there's no direct cause for it. Sometimes the cause could actually just be menopause, and so treating menopause might actually help those symptoms. Irritable bowel syndrome is a condition where you get gas, you get bloating, you can get diarrhea or constipation, depending on what you get in terms of your own condition, and it usually is worse with stress. So when people get stressed, they tend to get more of these symptoms, so the bloating, the gas, the diarrhea, and so often they get diagnosed with that, but it could all be because of the hormone deficiencies. Fibromyalgia is another condition similar to chronic fatigue, except in fibromyalgia, people get pain in lots of different parts of their body, and the pain is not just, random aches and pains. It's very severe pain that can disable them. So sometimes they're literally bedbound because of how severe their joint pains are. And so sometimes people get diagnosed with fibromyalgia, but it could actually be that menopause treatment may help those symptoms. And then, as I said, recurrent cystitis, which is urinary tract infections, or thrush, which is like a fungal infection that tends to affect your vulval area or your vaginal area. And again, these things have other treatments for them too. Okay. The one thing that's really important to note about is once you're postmenopausal, so when your period has stopped for 12 months, any bleeding after that, whether it's after intercourse, whether it's a random day of spotting, any bleeding is abnormal. It doesn't all necessarily mean it's cancer, but cancer does need to be ruled out. So any bleeding after menopause is abnormal and you need to see your doctor for it. Whether they then choose to monitor it or investigate it, it'll go by what your history is, but it is always considered abnormal. Okay, so if there's one take home, that's one that you should remember. So, in summary, menopause is natural. Everyone goes through it. The average age is 45 to 55 years old. Severity can vary, so don't disregard other people when they tell you that they're really struggling with menopause. And conversely, if you're struggling and you ask people about their experience and they say, "No, there was nothing, it was fine," people just complain sometimes. Don't take that seriously because it is. If you're going through something severe, don't take that for granted. It's important for us to openly talk about it. We need to open that dialogue about all of these really, really important, but really difficult to talk about topics, because the more we talk about it, the more we normalize it, and the more we're going to be able to access more support because it becomes a problem that's identified. If we keep it to ourselves or accept it as just a phase of life, one, we're the ones who are struggling, but we're also making it harder for our future generations who also get to that phase where they're just adapting the idea that as women, this is something we just naturally go through. It doesn't have to be the case. There are treatments for it, so speak to your doctor. And lastly, feel empowered to advocate for your own health. It is something I encourage my patients to do all the time. When you go in, if you've seen your doctor about an issue and you think there's something else wrong or there's something else worrying you about it, for example, you talk to them about your recurrent urinary tract infections and they never mention menopause, don't feel afraid to mention it and say, "Look, I believe that this can be a cause of it. What do you think?" Feel empowered to advocate for your own health. No one's going to take you offensively. If it isn't something that they think is an issue, they can explain that to you. But if you don't bring it up and it's something that they haven't thought about because maybe, they don't know much about the area, you're the one who's losing out. These are some resources I have. I'm happy to send out the list as well. And I've written next to it what part of these websites I think are particularly useful. Please feel free to use them. They have a lot of great information on there. There are many more. And if you want, I'm happy to direct you to other resources too. And again, I'm really happy to support you. If you are struggling with any symptoms, if there's anything you want to talk about, in terms of you want more information, I'm more than happy for you to get in touch with me. Um, I'll put my email address in the chat box, and you're welcome to send messages. Everything is confidential. I don't tend to talk to anyone about anyone. No one knows who my patients are within the Jamaat. So as much as I wouldn't be able to provide any treatment, I'll be happy to advise you about whether something is important for you to see a doctor or what you should do next. Okay. Thank you for listening. Any questions? No one has any questions? Let me just, I'll
You
put
s-
my, yeah.
you spoke about menopause symptoms in type 1 diabetic. Is it anything different for people with type 2?
No. So the reason I mentioned type 1 diabetics is because type 1 diabetes is considered an autoimmune condition, which basically means that it's your body that's attacking its own cells and it's unable to produce insulin as a result. So in people with type 1, you can get menopause earlier. That's the only difference. The symptoms are the same. It's just that there is more chance of you getting into menopause earlier. So, earlier than the 45 to 55, or, closer kind of to 45 than someone who doesn't have type 1 diabetes.
Thank you.
No problem. I'm just putting my email address. Feel free to get it if you like, if you want to message me too. I'm usually accessible. I'm not great with answering my phone, but in terms of phone calls, but you're welcome to text me and I will get back to you at any point, okay? So I'll put it on there. .com. Okay, so I put my details on there. Okay. I hope you found this useful. And if not, please don't hesitate to come and tell me. I won't be offended, I promise. Because I do want to improve this if you feel like there's something that was lacking or anything at all. Okay. So next week, Dr. Rashida will go through, actually, I'm going to put it back on the slides for the resources. But yeah, Dr. Rashida Shamsun is going to go through all the treatment options. Okay.
Suppose we are not able to join next week, will it be the recording? Will it be shared?
I'll need to ask Benza. We are recording it with the intention that if we get result, we can share it. So yeah, I definitely will ask, but just reach out to me after words as well if you're not able to. And yeah, and I know we'll get that, we can get that sent. And if anyone wants the slides as well, please let me know.
Very informative session. Thank you.
No, my pleasure. And yeah, again, if there's other topics that you feel you want, I know we're doing a mental health one as well. So the next one is going to be the treatment of perimenopause. 2 weeks later, we're going to do one on the different cancer screenings. Um, so just yeah, so that's on cervical cancer, breast cancer, and colorectal cancer. And then after Ramzan, there's a psychiatrist who's going to do one on mental health. We're going to try and get different speakers for different sessions, particularly because it's something that they want to talk about, or if they're specialists in that area, then they're going to do that. So yeah, please feel free to take advantage of these talks. I did send out the email originally that had all the topics. We're going to keep to that, and then obviously if anything changes, we can always we'll inform you. We'll send an email out with the new date.
Can I ask you one question? May not be related to the topic, but
Sure.
like if people have who have the GP is not a female, if it's a male,
Yes.
and we want them. I mean, usually females are not open to talk about this topic with male doctors, right? Is there something like a women's clinic or something where we can ask them to refer to, like?
Yes, yes. So always, if you have any medical issue, or even if it's something where you didn't realize you'll need an examination and you don't want your male GP to examine you, you always have the option to ask them to refer to you to a female. It doesn't have to be a specific women's clinic. There are many, and they can refer you to a specific gynecologist. But sometimes it's just so. In my clinic, there's four of us, three of us are female, and there's one male. And often I will send my male patients for intimate examinations to the male doctor and vice versa. All you have to do is just ask your doctor and tell them, look, I don't feel comfortable. in being examined by a male doctor, can I get a referral to a female? And they'll happily do it. It's
The
something that happens very often.
Yeah, the problem is my doctor has referred me to a female gynecologist, and there's like
Yeah.
a lot of waiting
Yes.
time.
Yes.
And the person calls me up from the reception, said, "Are you pregnant?" I said, "No." Okay, then we cannot take you. We'll call you back when we have time. Like, or we
Yeah.
have another cancer patient, so we have to give more first preference to. I mean,
Yeah.
that's the state of waiting here. You know.
Yeah, so gynecologists' waiting time is really, really long. But as family physicians, we're actually able to treat a lot of gynecological issues. So yeah, just ask to be referred to another GP. We can speak about it as well later, and I can advise you
Okay, sure.
specific
Thank
to your
you.
situation. But yeah, just get in touch with me later. But
Thank you. Thank you.
there's usually some kind of access, and if you can't get a gynecologist, then sometimes even a female GP is enough. If it's just a matter of having a conversation, because sometimes if you're not comfortable talking about the issue in itself, it might actually be something that um, any doctor could really get you started on treatment for. And so for that, you don't necessarily need a specialist. For a specialist, is usually if it's something that's beyond our scope, or like it's something that we directly can't treat. Um, yeah. So yeah, just get in touch with me later, and I can advise you accordingly.
So I can go and tell my GP, can you refer me with my blood results to another female GP? Is it
Yeah.
possible?
Yeah, it's possible. But yeah, if you're having problems, just get in touch with me.
Okay, sure, thanks.
No problem. Okay, so if there's no more questions, I think that's all. I'll hang around for a bit longer if someone wants to ask or add a question in the chat. But yeah, thank you all for attending. And hopefully, inshallah, we'll see you next week.
Thank you so much.
You're welcome.